Welcome back. We begin a new segment today with Dr. Harpreet Lotay from Sona MD. It's great to have you on the show. Welcome.
Thanks, Susan.
Yes.
I'm excited to be here.
We're glad to have you.
Yeah.
We're talking today about two different treatment methods. They're called cool sculpting and Belkyra, and these treatments are helpful for many reasons.
Yeah, they sure are. But what I wanted to go over today was really a non-surgical approach to the treatment of double chin.
Okay.
So a lot of patients may inherit that trait from family, and they may not be too pleased with it. It's also an area that's very resistant to lifestyle change, so many people find it frustrating in that regard. And a lot of people think the only option available to them is surgery, but that's not true. We have a lot of non-surgical approaches too. So I wanted to share with you some treatments that we've done using both cool sculpting and Belkyra. And
okay, so we just sort of passed by the first picture, and that was a picture of somebody that's suffering from the obvious...
Yeah, so I think these pictures might be a little bit out of sequence. So
okay.
If we can go to the very first picture, it's the before picture of the three. I can share with you how this person's treatment progressed.
Yeah, I'm hoping we can get to that picture.
Yeah, and if not, we can talk about cool sculpting and how to... Yeah.
I might have had them out of order. Perhaps we can just keep going through these and see if we find the one that you'd like to start with.
Sure. Well, let's talk a little bit about this picture.
Sure.
This is really outlining cool sculpting. Cool sculpting is a really neat technology that uses cold to trigger cell death in fat cells. So if you cool fat cells down enough, they will die off. You have to protect the skin, obviously. And this applicator that I have with me sort of helps me assess whether or not a patient might be an appropriate candidate for the treatment.
Okay, this is a substantial change here, you have to admit, for this picture.
Yes, absolutely. So typically with one treatment session, you can expect about a 20 to 30% improvement. And if you do 2 sessions, you'll have a compounded effect.
Okay.
In our office, we recognize that people are very unique. Their facial characteristics are unique, and the way that their fat is deposited is unique. So we have few options to treat concerns. So cool sculpting is non-invasive. You can go right back to work. No one is any the wiser. There's no bruising. There's typically no redness, nothing like that. So that's a wonderful thing about the treatment. And this is the applicator. I don't know if the viewers can see that.
Let's hold this up.
Yeah.
And so you use this to assess, is that right?
So in yourself, you don't have much there. For example, I would put that here and see if, you know, and if you had concerns, you may be a candidate because the applicator would fit nicely. So we would assess you there. Now, you're slim, so sometimes this applicator will rock, and so it's not an appropriate treatment. For patients for whom this isn't an option, we do have something else called Belkyra.
Okay.
Belkyra is an injectable treatment.
I can hold this up.
Sure, absolutely. It's a naturally occurring molecule. We actually use it every day when we have lunch or when we have dinner or have a snack. Our pancreas releases bile acids. And one of the bile acids is deoxycholic acid, and it basically breaks down fat and allows it to be easily digestible. When you inject it into a fat pocket, it lyses or breaks down fat, and then our natural body's mechanisms for dealing with waste products take over and clear the system.
Why isn't everybody using this stuff? How much can you put in at once?
Yes. Exactly. It's an acid. So, you know, you can have bruising, you can have a bit of swelling.
Sure.
You want to keep it away from anatomically sensitive areas like nerves. We don't want to damage those.
Sure.
So there are, you know, anything that's effective usually has some associated potential issues. And so we need to be aware of that and always keep our patients safe while giving them the most effective treatment.
Right.
Yeah.
So that can be used for a chin as well, should you not qualify for the first.
Absolutely.
And how many treatments are usually needed for the Belkyra?
So it's very patient dependent, but we typically suggest 3.
Okay.
And so in our clinic, if you are someone who would require 3, you typically would be a candidate for cool sculpting. So we'll often use cool sculpting to debulk the area first.
Okay.
And then finish up with the deoxycholic acid.
Okay.
But of course, it depends on the fit and so forth.
Sure.
That allows us to give you an effective treatment with much less downtime, and it is also a little bit more economical for the patient. This this can get spendy if you're doing 3.
Sure.
Well worth it though, because no surgery, no downtime.
That's right.
No anesthesia,
You can go right back to work.
Right back
and a little
to work.
bruising, that's not too big of a deal.
That's right.
We have those other 3 pictures. Maybe we can just go to them and see what we come up with. And if you would like to speak to them, you can.
Sure, just to give people an idea of what you may expect.
Yes.
Yeah, a lot of people are not. So this is a treatment of a male patient with Valkyra.
Yeah. What a difference. You can really see it.
Absolutely. And what I like with Valkyra is sometimes you get a bit of tightening occurring too, which is nice. Yeah.
Okay. There's another side.
So.
And how many treatments would this have been?
I suspect this was someone who needed 3.
Okay.
If you look at the amount of fat deposit, it's reasonably substantial.
It makes the person look younger, it seems, as well.
It absolutely does. Absolutely does. So part of the aging process is a change and a shift of where our fat tends to sit. I think I'm familiar with that anyway.
Oh, I am too.
But yeah, so when we do sculpt the jawline, it does make you look younger, absolutely. More refreshed, a little bit more vital, and who can't use a little bit of that?
Absolutely.
Yeah.
Anything else you'd like to add? We have about 30 seconds or so left. If people are interested, they can come and talk to you about this, obviously.
Absolutely, yeah. We offer free consultations for cool sculpting, and that's a treatment that can be used on the abdomen, the flanks, the inner thighs, back of the arms. It's so safe that it's been used worldwide, over 4 million treatments done worldwide, and we've done hundreds here in Kamloops. If you're interested in that, please come see us. That consultation is free. We do offer Valkyra fillers, Botox, and want to help you really make the best choice for you and just inform you. That's our goal.
Yes,
Absolutely.
lots of honesty about what you think will work.
Absolutely.
Fantastic. Dr. Lotay, thank you for being here. We look forward to having you here on a monthly basis. We can talk about things that are of interest to people that, you know, treatments that people might not even know exist that are absolutely something that could change their life. So it's great to have you here.
Yeah, I look forward to it. Yeah,
fantastic. If you'd like to learn more about this particular treatment in dealing with a double chin or other problem areas on your body, sonamd.ca. The phone number is on the screen as well, 778-471-6555. We're back after a quick break. Stay with us.